Hello, everyone. My name is Bobby. I will be presenting on the topic of hypertension. I will provide a brief introduction to the topic, following with some background information, symptoms, causes, and some current news and information regarding the topic. Hypertension is termed the silent killer as most of the time it has no obvious symptoms to indicate that something has gone wrong with the body. About 75 million American adults, that's about one in every three, have hypertension. Anyone, including children, can develop the disease. People with hypertension, which is often referred to as high blood pressure, do not even know that they have it. It's developed slowly over time. Hypertension is a disease which has no cure. The device in the picture is a sphygmomanometer, which is an instrument for measuring blood pressure. The definition of hypertension is a sustained elevation of blood pressure. Blood pressure is a combination of two measurements. The systolic blood pressure is a measurement of the pressure in your blood vessels when your heart beats. The diastolic blood pressure is a measurement of the pressure in your blood vessels when your heart is at rest between beats. An individual is diagnosed with hypertension if the systolic blood pressure is greater than or equal to 140 millimeters mercury and the diastolic blood pressure is greater than or equal to 90 millimeters mercury. There are four classifications of blood pressure. Normal blood pressure is defined as the systolic blood pressure being less than 120 millimeters mercury and the diastolic blood pressure being less than 80 millimeters mercury. Pre-hypertension is the systolic blood pressure between 120 to 139 or the diastolic blood pressure between 80 to 89. And stage 1 hypertension is defined as the systolic blood pressure being in the range of 100 to 150, 140 to 159 or the diastolic blood pressure between the range of 90 to 99. Stage 2 hypertension is when the systolic blood pressure is greater than or equal to 160 or the diastolic blood pressure is greater than or equal to 100. There are two classifications of hypertension. Primary or essential hypertension is the most common type of blood pressure, and this tends to develop over years as a person ages. This type of blood pressure seems to have no known cause and is prevalent in about 90 to 95% of all cases. Secondary high blood pressure is caused by other medical conditions and the use of certain medicines. This type usually resolves after the cause is treated or removed and accounts for about 5 to 10% of all cases. There are some contributing factors to primary hypertension, which include an increase in sympathetic nervous system activity, diabetes, an increase in sodium intake, and excessive alcohol intake. The sympathetic nervous system plays an important role in the regulation of arterial pressure, and increased sympathetic nervous system activity has been implicated as a primary precursor of hypertension in both human and animal models in studies. The mechanism responsible for the increase in sympathetic nervous system activity has not been fully explained. In sodium chloride sensitive hypertensive subjects, dietary sodium chloride increases sympathetic nervous system activity both directly and indirectly. And in addition, recent studies suggest that insulin, glucose excess, and nitric acid deficiency may increase the sympathetic nervous system's contribution to some forms of hypertension. The consumption of alcohol also increases risk of developing primary hypertension. And some contributing factors for secondary hypertension include coarctation of the aorta, renal disease, endocrine disorders, and neurologic disorders. As can be seen in the picture, coarctation of the aorta is a narrowing of the aorta, the large blood vessel that branches off your heart and delivers oxygen-rich blood to your body. When this occurs, your heart must pump harder to force blood through the narrowed part of your aorta. Renal failure or kidney disease is the gradual loss of kidney function. Your kidneys filter waste and excess fluids from your body, which are then excreted into your urine. When chronic kidney disease reaches an advanced stage, dangerous levels of fluids, electrolytes, and waste can build up in your body. The endocrine system helps to control many important body functions and influences your heartbeat. Excessive adrenal glands can lead to fluid retention, loss of potassium, and hypertension. The autonomic nervous system is part of your nervous system that controls involuntary actions such as beating of your heart and the widening or narrowing of your blood vessels. When something goes wrong in this system, it can cause serious problems, including high blood pressure. Some risk factors for primary hypertension include family history, obesity, ethnicity, physical activity, physical inactivity or the lack of exercise, overconsumption of alcohol, and stress. High blood pressure is particularly common among people of African American descent, often developing at an earlier age than it does in Caucasians. Serious complications such as stroke, heart attack, and kidney failure are also more common in African Americans. People with a body mass index greater than 30 are at an increased risk of developing hypertension. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction and the stronger the force on your arteries. And over time, heavy drinking can damage your heart. Having more than 2 drinks a day for men and more than 1 drink a day for women may affect your blood pressure. And lastly, high levels of stress can lead to a temporary increase in blood pressure, which may become permanent combined with other factors. Some hypertension complications. Atherosclerosis is a slow, progressive disease that may start in childhood. Some hardening of the arteries is normal as you age. However, scientifically, the plaque begins when an artery's inner lining called the endothelium becomes damaged. Three possible causes of damage are high blood pressure, elevated levels of cholesterol, and cigarette smoking. As arteries harden with plaque, blood clots can become more likely. And the most common complications target organ diseases occurring in the heart, brain, kidneys, and eyes. The damage or death of part of the heart muscles that occurs as a result is called a heart attack or myocardial infarction. Renal hypertension is a slow decline in kidney function. Uncontrollable high blood pressure can lead to stroke by damaging and weakening your blood vessels, causing them to narrow and rupture or leak. High blood pressure can also cause blood clots to form in the arteries leading to your brain, which will cause blocking of blood flow and potentially causing a stroke. Hypertension requires collaborative care and major lifestyle modifications, including weight reduction, dietary changes, limitation of alcohol intake, regular physical activity, avoidance of tobacco use, and stress management. The DASH diet is a plant focused diet rich in fruits and vegetables, nuts with low fat and non fat, dairy, lean meats, fish, poultry, mostly white grains, and heart healthy fats. It lets you fill up on delicious fruits and vegetables, paired up with protein rich foods to quench your hunger. And drug therapies include diuretics, adrenergic inhibitors, beta adrenergic blockers, ACE inhibitors, and calcium channel blockers. Diuretics inhibitors reabsorption of salt in the body. They work on your kidneys by increasing the amount of salt and water that comes out through the urine. Adrenergic inhibitors inhibit the stimulation of the central nervous system, alpha adrenergic receptors, and decrease sympathetic stimulation to the blood and the heart. Beta adrenergic blockers make the heart beat slower and with less force, and relax the blood vessels. All these actions can lead to decrease in blood pressure. As a result, some side effects of these blockers include hypotension, heart failure, bradycardia, which is slow heartbeat, and impotence. Angiotensin converting enzyme or ACE inhibitors are medications that slow the activity of the enzyme ACE, which decreases the production of angiotensin 2, a peptide hormone that causes vasorestriction and an increase in blood pressure. As a result, vessels enlarge or dilate and blood pressure is reduced. Calcium channel blockers reduce electrical conduction within the heart, decrease the force of contraction of the muscles, and dilate arteries. Dilation of the arteries reduces blood pressure, and as a result, the heart does not exert itself too much. An article published in Science Daily on November 15, 2017, wrote about a study conducted at MIT which claims that a certain strain of bacteria may be able to control the population of a type of immune cell in the gut. These immune cells have shown a link to hypertension. The researchers are hypothesizing that the microbe may be developed to protect against the effect of a high salt diet, which leads to hypertension. And these are my works cited. Thank you.